how does COVID-19 compare to other outbreaks in the past, and what are infection preventionists doing across the country right now?
Well, the world has suffered from many infectious disease outbreaks, epidemics, and pandemics over time. If you think about smallpox, Spanish flu, polio, pertussis, measles, HIV/AIDS, H1N1 flu, just to name a few. But no matter what the cause of the outbreak, our systematic epidemiologic response follows similar steps. First, we have to past trends and expected outcomes in order to establish the existence of the outbreak. It usually starts out with a suspicion that trends are increasing or things may be beyond what we'd expect, but we need to go ahead and establish that first. And then we need to determine exact diagnose and or test for the condition. And also how to develop a case definition in order to start tracking people over time that might be suffering from the condition. After we've done that, we want to find these cases, so we have to conduct surveillance by systematically collecting information about them. And this helps us to describe what's going on. This lets us know who they are. And only from this systematic collection of information can we actually develop various hypotheses to help explain what's going on, as well as to help begin to implement effective prevention and control measures. At this time, IPs around the country are working tirelessly to help us with this particular step of our public health response efforts. They're the ones in the healthcare sector and the hospital settings that are able to conduct ongoing surveillance to identify any suspect COVID-19 cases as soon as possible. They're also the ones that are constantly educating healthcare workers in their facilities on ways to protect themselves, whether it's hand hygiene or using protective personal equipment, ensuring that those stocks are adequate and that protection is actually available. Those resources are available to staff, as well as educating on how to protect patients, other people, anyone else in the healthcare sector. They're also tasked with jumping on top of any suspect COVID-19 situation and ensuring that any suspect case is isolated as soon as possible. This is what's going to minimize all chance for additional exposure to other people. And they're also helping to connect these suspect cases with appropriate health authorities. This helps us to continue collecting information on these cases from a public health stance. Also, we need our IPs in order to help test and diagnose these cases and getting those tests out, getting those results disseminated so that we can move forward with any additional responses there. And then lastly, there are lots of visitors and additional traffic that comes into the hospital. So we can't forget the fact that IPs a lot of times are the ones educating these visitors, as well as patient families, to help prevent further spread even outside of the hospital within the community. I'd say outside of a lot of those prevention and control measures that our IPs are working on, as well as other public health members in the community, a last step to our response is always to communicate findings as soon as possible. No matter whether it's an outbreak, epidemic, pandemic, you're going to get a lot of information as it's made available. There's been a lot of information sharing with the current COVID-19 pandemic. And I think a lot of us would say it's even information overload, but I can't stress enough how important it is to stay up to date, to listen and to adhere to public health recommendations as they come out.
Thanks for that.
Yeah. So I have a question for you, Steve. Can you talk about what the most important COVID-19 response priorities are for pharmacy and or antimicrobial stewardship programs right now?
Yeah, I think I can tackle that, in two ways, depending on the practice setting for these pharmacists. On the hospital side, I think one of the biggest challenges right now is to making sure that we are managing the drug shortages. We know that We have a sudden surge in patients coming in the hospital kind of with the same condition, as well as interruption in the global supply chain has caused a lot of problems with managing the drug shortages. So I think pharmacists need to take a much more active role in managing them, identifying potential alternative drugs. And along those lines, I think it's important to start educating our providers and nurses on these mechanism of actions as well as the expected side effects of these older drugs. When the first line drugs have run out, we often go to some of these older agents that many of the recently graduated new practitioners may never had experience using them before. So it would be a very good time for us to brush up on the half-life, side effects, mechanism of actions of these drugs. So we've already heard about shortages on sedatives and anxiolytics and a lot of these drugs that are commonly used in the ICU for patients on ventilators. We're also expecting shortages on antimicrobials. Some of these patients with COVID-19 will inevitably develop secondary bacterial infections. So we want to make sure that we just do things that we already know how to do well as antimicrobial stewardship pharmacists, identifying patients with new onset of these bacterial infections, getting them on the right antibiotics, de-escalating them when microbiology results come back that can suggest a narrower agent that could be used, and then also monitoring duration of treatment and discontinuing them when the drugs are no longer necessary. The other end for the hospital pharmacist would be managing the newer agents in terms of the investigational drugs or using older drugs that have been available in the market off-label for COVID-19. So in terms of helping our providers, in terms of getting the investigational new drug protocol approved, participating in the clinical trial, as well as the compassionate use of some of the other drugs. These are processes that are probably familiar to the academics, but for everyday care practitioners, these are relatively new things that we can help them in getting those paperwork started and completed and ensure that we're in compliance with those regulations. On the community pharmacy side, I think there's some interesting development. The Department of Health and Human Services has announced that pharmacists are given the authority to order as well as administer COVID-19 tests. As we all know, pharmacists are the most accessible healthcare providers in the country. So our profession is being asked to help manage a lot of these infections in a community setting. Even though we hear a lot on the news about sick patients getting ventilated and such, the truth of the matter is a lot of the patients can be safely managed at home in the ambulatory care setting. So I think it's important for the community pharmacists to start familiarizing themselves with the protocols. This is a situation that's evolving and changing on a daily basis, so it's important for them to stay in touch with their public health department to understand as the availability of the testing ramp up, what are the recommendations in terms of who should be tested. And then obviously now we're putting pharmacists in a setting where they're administering a diagnostic test, so they probably should familiarize themselves with infection control measures so that they can protect themselves, their staff, as well as their patients who are coming to their pharmacies to get tested. And then finally, as we mentioned, if these patients are going to be managed at home, we need to make sure that we have the educational material and counseling available to give to our patients as we send them home with the diagnosis of COVID-19 or not, and how they can help make sure that they don't get into trouble, if you will, as well as infecting others in the household.
Absolutely. Thank you for that. Very interesting.